Time for our injury report on the Pat and Aaron Show, presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us on the hotline today, Dr. Eddy Echols. Dr. Echols, how you doing today?
I am doing fine, and yourself?
We're doing great. We're a little upset the Bucs are out of the playoffs, but with football, we can't stop watching because we love it. And I got to, Dr. Echols, I got to ask you this. Pat and I were talking about this earlier in the week with each other, and we just thought this was crazy. It was revealed on Monday that Broncos quarterback Bo Nix played part of his rookie season with transverse process fractures in his back. It just sounds horrific. What is a transverse process fractures? Is it as bad as it sounds to me?
Well, not necessarily. So basically, the transverse process, what happens, without getting too in-depth, is that in your spine, you have your vertebrae, and then you have these little bone projections from the side of the vertebrae, which is the transverse process. And ultimately, there are muscles and ligaments attached to those little transverse processes. Now, they're not weight-bearing structures or load-bearing per se, so it's not as devastating as some other fractures of the spine could be. That being said, I mean, obviously, though, it takes a certain amount of toughness to play with those injuries because they hurt. And you can imagine in a game being played at that speed with that kind of force, certain hits and things and falling on your back is painful. So, I mean, it's commendable that he played with it and he, it wasn't voiced. And it didn't appear to affect his abilities too much, but that tells you how tough those guys are.
Yeah. Do people often have small fractures or injuries within their back or their spinal cord that maybe they don't realize?
Well, when you say people, if you're
talking
not
about athletes, the rest of us schmucks.
You know what? I would say this. I mean, I think the majority of the time, we end up with low back pain, and oftentimes, as we're getting older, we'll have degenerative disc and things of that nature. Routinely, when you have a fracture, you pretty much know. In our older geriatric population, they can have compression fractures of the vertebral bodies, and that's just because routinely in our females, after they go through menopause, the bone starts to weaken, your osteoporosis and things like that. And so they can be subject to compression fractures, which is a little different. Usually fractures like Bo Nix had are usually caused by some type of event, and you truly tend to know that you've injured your back in some shape, form, or fashion.
Tyler Higby, tight end for the Rams, he had to leave the game on Monday night because of a chest injury. He didn't get back in the game, and he was taken to a hospital. What could the chest issue be? Do you think the hospital visit was just more precautionary?
Probably so. So, obviously, once again, as you talked about playing a game at that sort of speed with that sort of force, I think the story was that he had kind of coughed up some blood on the sideline, and that's not a common occurrence. Now, obviously, chest injuries are not necessarily uncommon in football. They could be a myriad of things, but I think because he had coughed up some blood on the sideline, then obviously that's like, okay, hey, wait a minute, what's going on? And so to that end, then you're going to take him, to the hospital to be evaluated, and that can be anything from, say a tear or irritation in the throat to potentially like a collapsed lung. And so, and that could obviously go to things even more serious than that. But in general, I think that was more precautionary because, as I understand it, he was up, he was talking, he was, functional. So to that end, it was more of a precautionary thing. But you definitely want to know it's not common to cough up blood per se.
I'm glad to know that. Yeah, if I coughed up blood, I thought I would think I was dying.
I'd freak. Yeah.
It would be the end for me.
Well, chances are, if you coughed up blood, you're not playing professional football, so yeah, more times than not, there's probably a more serious issue going on.
Yeah, Doctor, we don't usually allow our audience to troll the doctors come on the show with us. However, given what we saw about a month ago in D.C., Aaron and I, when we were there, I thought you may want to respond to this last text that we got that said, "Tell Dr. Echols, go Army, beat Navy."
Well, see, here's the thing. I don't know who sent in that text, but I am a Naval Academy graduate.
Yep.
Thank you.
And I will say that this year, both the academies had very outstanding years. And actually, West Point had a better season than Annapolis. And so going into that game, I must say I was a little fearful that Army would prevail. But if anyone watched that game, they then know that the midshipmen stood up in their traditional form, and we whipped those boys pretty good.
Oh, I know. My wallet knows too, Dr. Echols. I was sitting there watching my money just go away.
Hey, never bet against Navy, man. Never bet against Navy.
I learned a tough lesson. I should have learned in the Malcolm Perry years. I guess I didn't learn. I want to ask you about Nakobe, Deen. He is a guy who is he tore his patellar tendon in last week's game in their win. He's done. What's the patellar tendon?
So the patellar tendon is what attaches your kneecap to your leg bone. All right. So when you're straightening your knee per se, you can feel it. If you feel right below your kneecap, that structure is your patellar tendon, and that's part of what we call the anterior mechanism, which allows you to straighten your leg. So obviously running and things of that sort, the patellar tendon is instrumental in that. That being said, he's done. And it's unfortunate for the Eagles because an injury like that, he won't be able to come back this season. So obviously I'm pretty sure he's probably had surgery already and is well into the rehab of it. But you got to let those, the tendon heal, and then you got to strengthen it back up so that, he should be ready to go next season.
What about by training camp?
Training camp, I think, starts in the summer. So this is what? This is January? Yeah, that's possible. It's possible. Obviously, with those athletes, they're very well conditioned, and, of course, they're getting treatment and everything around the clock, which is why I suspect he's already had surgery. So at this point now, the tissues are being allowed to heal. And so chances are he should be able to go by training camp. We'll just kind of have to see. You want to make sure you don't have setbacks and things like that, kind of like Deshaun Watson with his Achilles. You want to make sure you don't have setbacks in your rehab that could potentially then throw off that time clock. But all things going as expected, he should be able to get back by training camp.
Here in Tampa Bay, a lot of Buccaneers fans hoping we're going to be able to re-sign Chris Godwin to the team. Obviously, he's coming off of what looked like a really gruesome injury with that dislocated ankle earlier in the season against the Baltimore Ravens. Is that the kind of injury that people recover from and they're back to themselves right away? I know a lot of times we say with ACLs, right? Like that first year back, guys are good, but it's really the second year back that they're back to themselves. How quickly can you return from an injury like that dislocated ankle to being back to the player you were if you're a guy like Chris Godwin?
Okay, so there are a number of factors that come into play with that. One, it depends on what structures were damaged, in the dislocation. You can have dislocations that are purely ligamentous, but usually there's going to be a broken bone associated with the dislocation. And so it's going to depend on what all structures were injured. And then as far as returning to form, once again, if the cartilage and that sort of thing were damaged, then you have to imagine that at some point in time, they're probably going to develop some traumatic arthritis. Now, that usually takes place over time. As far as getting back to, a high-performance level, everybody's different. And so, once again, for instance, for years, people, after Adrian Peterson had his ACL reconstruction and came back and played in like 7 months and played well, then, of course, everybody, wanted to say, they come in with ACL injury. They said, well, we want what Adrian Peterson got. Well, I'll tell you, Adrian Peterson got everything that everybody else got. It's just that Adrian Peterson was Adrian Peterson.
That's right.
So that being said, with Chris, it's going to depend on what structures were injured. And based upon that, then that's going to determine the timeline to when he does get back. But once he gets back, provided that he doesn't have any arthritic changes or things like that, then it's very possible he can get back to his pre-injury state.
That's potential great news for Bucs fans, especially Bucs fans that think that the Bucs are going to re-sign Chris Godwin this offseason. The Pat and Aaron Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule your appointment today at floridaortho.com. Dr. Eddy Echols, we really enjoyed the conversation today. Thanks so much.
Hey, thank you. Enjoy talking to you guys.
Thanks, Doc.
Go Navy.
Okay.
All
right.